So, there's all kinds of kookier that you have to think through, but a couple more to just think about. One is the mild versus moderate drama. Aricept works in every Alzheimer's patient. So there is no difference between whether it works mild, moderate, prodromal, end of life, hospice. Like, it works everywhere. There is no specific place where it'll stop working. CML is the same way. If you have BCR-ABL inhibitor, you could literally be 10 minutes from dying and it'll work. Or you could be like one mutation and it'll work, and everything in between. Same thing with Rituxan, the same thing. Like, this whole mild to moderate of like just accepting that right away is nonsense. If you have severe headache and you take or severe backache and you take oxycodone, you'll get relief. If you have a very minor, strain, toothache, and you take oxycodone, you'll also get relief. You could have cancer pain, literally like end-of-life pain, and you get oxycodone. And you could have modest lower back pain and get oxycodone. It doesn't mean, because I have mild pain versus moderate versus severe, that my agent is going to all of a sudden just stop working completely. You're going to get some physiological response in every patient. You may not get as potent of a physiological response, but you will get a response. And this is just natural pharmacodynamics. Like, there's just no debating this. There's very few diseases where at this specific line in the sand, which is artificial line, saying if your cognition score is this much, imagine saying IQ of 110. Well, above this IQ of 110, it doesn't work, but below it, it does. And this is just a silly idea, and we're accepting it completely. Now, I'm not saying it's impossible, but I'm putting it in the same realm that the PPI was designed by accident. So when you compound two different unlikely things, you're basically saying there's, they both have to be necessary and sufficient to get you across the finish line. And there's a couple of more things like this. And when you add up every necessary but sufficient and sufficient, sufficient and necessary, it's not sufficient, actually. These aren't sufficient. They're all necessary, but they alone do not allow you to have an Alzheimer's drug. They are just complete prerequisites and very much necessary to get across the finish line. There's like 6 or 7 or 8 of them that I've listed. And the last time I did this, there's a couple of drugs like this and situations like this where, like, once you start adding, like, okay, there's a 5% chance this is true, there's a 5% chance that is true, 0.05 times 0.05 is a very small number. And you add a couple more of those, and you're basically saying it's possible. The guy who did the big polymarket bet on Trump, he said that he thought it was a really great bet because there was a 50% chance for those 3 swing states that Trump would win. The polling was very tight. And that Kamala, in essence, mathematically had to win all 3. And the probability of winning all 3 50-50 bets is 12.5%. And the market was pricing it at 50%, erroneously. But she actually had to win PA and 2 other states, and they all looked fairly close, and he was right. And that wasn't the perfect interpretation of the situation, but the idea of compounding probabilities is a very important one in medicine and predicting any statistical outcome. So, I think that this is a safe short for that reason, because it's very it's very hard to jump through every hoop and hurdle like this, clearly and easily.
Yeah, I like the magic wand that they have been busting out where cemiphalam touches filament A once and it is magically fixed. The altered form disappears once it's been touched and graced with the presence of cemiphalam, because the effect lasts for 6 months, right?
Yeah, that's some of the most wild. That's probably the wildest part of the story, is that you look at the data, the controlled withdrawal, and you say, why is this data so bad? It doesn't separate. Says if I gave you any of the good drugs in the world, like the cystic fibrosis drug, I gave you that drug for 6 months and took it away. The day I take it away, you will notice the difference. And within 2 days of taking it away, like, you can't breathe again. Like, that's what a controlled withdrawal study should look like. Instead, they're saying, no, it doesn't work that way here, because when you start taking cemiphalam, it fixes you. and it takes you months to degrade again. Now they're again, the amount of medicines that do that in existence is close to zero. This happens with like infectious diseases. So like, let's say Hep C. You cure Hep C, you stop taking the pills, you're still cured until you get reinfected by somebody else. So infectious diseases, that makes sense. Cancer is sort of a quasi-infectious disease. It makes sense in cancer, you kill a tumor. But any other disease, when you stop giving the therapy, look no further than your favorite asthma drug you might take as an inhaler, or an allergy drug you take, or whatever it is, once the molecule is out of your body, a couple of half-lives, you will start feeling it. I start feeling my anxiety drug within hours of missing a dose. This is just natural pharmacology. There's nothing complicated about it. So the idea that there could be this 6 month, I understand maybe a week, 2 weeks, something like that, but a 6 month carryover effect. That is the only way that you could believe that controlled withdrawal study. And that is a big ask, especially when you combine all these other big asks of, well, also it just works in milds but not moderates, and it's a 6 month carry-on, and it's this complex protein-protein inhibitor without having a single chemist at the fucking company. And even that doesn't make sense because we don't even know what it's doing on the PPI side. Why is that even important? And the guy who got indicted isn't a big deal, and I have sympathy for that. There's a chance, I don't know what the percentage is, but there's a chance that the guy did nothing wrong and they're just beating up on him and this and that, but it's like 20%. But when you multiply that 20% chance by all these other chances, you're going to get a 0% chance. There's just nothing there. When you have a flat peptide surface, alpha, I guess it's not even alpha helix. It's just a flat sheet. It's yeah. The problem with binding that, as you know, you sound like a professional chemist, is your drug will bind any amino acid sequence of even some similarity, and it's not going to be high affinity. You know, you need space filling, you need pi stacking, you need shape complementarity, like just aligning parallel to like some other flat surfaces. There's not much you could do with that. You need serious hydrogen bond donation to be able to like form a very strong bond. You have to add these bonds up. Each hydrogen bond is only so strong. When we have such a small molecule, the small molecule can't make that many.
One aromatic group by stacking, it's nothing is there. Yeah, there's no meat on the bone. The thing is just a fragment.
Yeah, I
don't know.
I really like that.
This whole thing is just a fantasy.
I really like that perspective. I'm going to put that in my report. Calling it a fragment is very insulting and true, because it really does look like a fragment. I mean, if you look at the chemistry, it's kind of laughable. And if they actually got this drug from an old, there's no patent on the drug for this reason. They got it from an old pharma company's patent. And if you look at it, it's very kind of funny how they did it. But like, yeah, this methyl group and this benzene, they're like very kind of typical substituents. And they designed, the chemists who don't work at the company, they designed all these sulfonamides, like these really interesting looking molecules, but they took the most basic molecule of the series and just ran with that. And it was almost like, I was sitting here like, maybe this was just a fraud from the start, where they're like, oh yeah, let's pick this molecule, it's easier to make. And like all these sulfonamides and stuff like that, who cares? Like, we're just gonna run this with this if it's good enough. And you have the ketone, and outside of the ketone and well, it's funny because I've seen two different, in their patent, the ketone's in the 4 position, the carbonyl, and in all the other publications, it's in the 5 position. It's a very, very weird thing. Most pharmas have their own derivatives of Lipinski and improvements and stuff like that. But, you know, at the end of the day, there is work you can do to determine brain concentration. And they did that work. And in the investigator's brochure, buried in there, they said the brain was one of the tissues with the lowest partitioning. The spleen, liver, heart, like those were high partitioning, and brain and retina were like low partitioning, which is like, wait a second, that's not good. And this is what happens in these like cult retail stocks. Like, my favorite question to Cassava people is they say, oh, forget about Cassava. What other biotech stocks do you like? And they're like, I don't know any other biotech stocks. Because
Yeah, so it's a cult. Yeah.
because it's like, well, if you have such strong opinions on this biotech stock, you must know Neumora, you must know Humacyte, you must know Amgen. Like, let's talk about GLPs. And they're like, I don't know. It's like, oh, you just know this one, and you know that this one is the best one. For somehow you've determined that this is the best biotech. You haven't looked at any other ones. And it's like, look, I've been in biotech 20 years before you. I'll be here 20 years after you, looking at drugs. And that background and experience has given me a lot of ability to determine what the dogs are. This is one of the biggest dogs ever. And like, after this fails, you're going to quit investing in biotech, because there's no point in for you after this, like, you're just going to be like, I hate this space. Like, I tried it once and it never made money, and I'm not going to, lose money twice. And this story has repeated itself for me since I started in this space. It's the same story every time. They say, oh, Martin, or whoever, I used to go on these message boards and troll a little bit. This one thing called Satori, they're like, oh, you're wrong. If you write something like that isn't perfectly exact, like, they call you a moron and tell you that, like, you don't know what you're talking about. But those people don't stick around the industry. Like, in hedge funds, what's funny is if you make a bunch of wrong calls in hedge funds, you lose your job, and you got to go to another fund, and they don't want to hire you because they know you're not good. So the only people that survive on Wall Street are the people that are like relatively decent at their job. And there are people on Wall Street who we see and we're like, just kind of like look at them with, like, they'll end up doing IR, or they'll end up doing like some like fake fund that doesn't have any capital or something like that. They're not serious players. And, we just know that they're goofballs. And that's what the retail shareholders of Cassava are. They're just like, they're not particularly sophisticated. And they did a survey in their Discord about, was this your first biotech? And 70% said yes, which is like insane. If this is like, you should have a 1% position to practice this. Even that's too much. But let's say you have a $100,000 account, put $1,000 in Cassava, 50,000 or 70,000, put 1,000. And if it's a huge home run, you probably will make a great return. It could be a 50x. You make 50% return for your whole stake by only risking 1%. And then take the brilliant knowledge you have of biotech and keep investing, you'll be a billionaire. I've seen it happen. But to put all your money in this thing without even thinking about, like, am I bad at this? Am I good at this? Am I okay at this? What is my hit rate? Over time, my hit rate's like 60%. 60. Not 99, not 1, but like, it's still very uncertain. Any given pick I have, it may work, it may not. Intellia's, been a big embarrassment for me, but a lot of my other picks have worked out really well. But that was one of my best picks, and it's just been a dog stock for years. And I don't sit there and cry about it. It's just the nature of investing. It's probabilistic. It's a distribution curve, probably a distribution function. Some of those functions are better than other people's functions, but nobody has a 99% hit rate, or nobody has a 5% hit rate. Everyone's in the 40 to 60 range. Some people are even a little better. And you just have to manage where you are in that distribution and pick the best you can pick. And that's my favorite part about investing, is that humility is very important. There's no sure things in investing, and you just have to bet probabilistically. That's why I get so excited about something like Cassava, because it really is deterministic and pure, that what's going to happen. Whereas like in tech and stuff like that, it's like, well, I don't know if people are going to like this product, and I have to do some channel checks and all this stuff. Here, it's like, I do the research, this drug doesn't work. It's the only asset they have. So you can actually get this pure, excellent alpha that's like so pristine. And yeah, somebody made a point here. Even at small or medium hedge funds, generalist analysts don't touch biotech. It's not like covering consumer or TMT. That's true. That's exactly right. Every hedge fund that I've seen, even some of the big tiger cubs, they're like, Steve Mandel, Lone Pine, he told me, he's like, yeah, we don't do biotech, man. It's just too hard. Like, we don't have the expertise. We can't compete with the guys that have the doctors and all that. It's like, Steve Mandel is telling you he can't compete in biotech. He's one of the best investors of all time. You know, at the end of the day, I want to hear the Cassava people just say, like, look, man, it's a potential 50x. The probability is low, but I want to make a 50x. And I want to buy a lotto ticket, but I feel stupid buying one in the Quickie Mart or in the liquor store, where, you know, that's where you typically buy one. I want to buy the more sophisticated lotto ticket, which is just, you know, a stock that could go up a whole lot, and it might squeeze the shorts or something like that. You know, which is, you know, again,
I hit it on a biotech stock. I'm a biotech investor.
Yeah, this is just such a hard. It's such a hard space. And, you know, you have to learn. I thought I knew biotech within 2 or 3 years of studying it. I was wrong. It took another 10 years to become pretty good at it. And it's hard won, hard fought. There's a ton of people where there is a, like, they think that, I think this has happened to Matt Nacktrab. This guy sold his company, apparently, now has a bunch of cash, which is great. God bless you. Capitalism rules. The guy's rich now. But he's taken a bunch of his money and bought the stock with it, 70 million. And, you know, it's just a reckless thing to do, because it's your first biotech, Matt. Like, yeah, you may be great at whatever tech thing you did, but like, this isn't that. And this reminds me of the times I've wasted money in spaces I don't know, but I at least tried to cabin those losses. So like, for example, a record label of $1 million. Okay, after $1 million, no more. I'm not a record exec, it turns out. League of Legends esports team, $1 million. That's it. I'm not losing any more money than that. And you pick a number that you're comfortable losing and say, that's it. But when you jump in, like, head first into a space you don't know, in an amount of money that, like, Bill Gates wouldn't put 70 million in this thing. You know, like, who does that? You know, the biggest biotech funds look at this and be like, 70 million, maybe a small flyer. That's a lot of money. Like, that's material amount of money to potentially lose it all. So I don't know. It's just a sad thing. There will be hundreds of more drugs. If you're actually good at studying a drug and determining whether it's good or not, you can become one of the richest people in the world. It's just a matter of, like, are you actually good at it? Because it turns out that it, in fact, is very hard. But if you are so good at it that you could find a Cassava, diamond in the rough, man, you're going to be set for life. You know, you take your talents and apply them to cardiovascular, oncology, every other field, and you'll be buying the best stocks. But unfortunately, I mean, I know the best drug investors in the world by name and by first name basis. And
You all rely on a team. I mean, you have a team. You can't do.
oh yeah, of course, yeah. But even those guys and their employees are so good, man, they get it wrong a lot. You know, all these guys are billionaires, and they still get it wrong a lot. And it's life, you know, you can't always be right. So here you got this extremely high risk, and, you know, we're allowed to make bets. We should all be making, you know, bets that we are comfortable and fine with. We do it every day, but it's very, very strange to, you know, want to make this big bet as your first bet. You know, try a few small bets first. You know, that's just prudent. You would turn 70 million to, like, potentially 3 billion. But the problem is, like, what are the odds of it? He says it's 95% chance it works. And I'm like, there's drugs in phase 3 that are finished phase 3, met their primary endpoint, is still not 95%. It's just such a, bro thinks he's SoftBank. 𝗏𝗏𝗘𝐢𝐬𝐤 lost $50 million investing in a game studio. That sounds like, again, a good cautionary tale of like, you make a little bit of money and then you start just throwing it away like an idiot.
Yeah, I mean, 𝗏𝗏𝗘 listened to the experts when 𝗏𝗏𝗘 was a guy in the cookie business. He made a fortune in cookies. And
McDonald's, right?
I don't know. Yeah. So 𝗏𝗏𝗘 basically, I was involved in this stock. I remember it so clearly. It was called Pharmacyclics. Before it became Pharmacyclics, they never changed the name, which is funny. But Pharmacyclics had a drug called Excitrin or something like that. And it was this like fake drug that failed for glioblastoma, brain cancer. And then they tried to do a subgroup, which is, you know, the classic mistake in biotech that never works. And then that failed. But his son had brain cancer or something. So he was like, I'm rich, I want to do something about it. Let me buy what publicly traded company has a brain cancer drug? And like, this is the only one that had this Excitrin. And he became the CEO, he bought all the stock, but he never developed the Excitrin drug any further. He just bought a bunch of new drugs. And it turns out, well, one of them became one of the most important drugs ever made. And he became, and you know, he made many billions of dollars.
He all came from Celera.
Yes, I remember.
Cautionary tale as well.
Yeah, but you know, he bought.
Oh, 𝗏𝗏𝗘, right? For Blood and Money. I really enjoyed reading it. I'd recommend it.
Yeah,
great book.
Yeah. So you know, getting that, getting a new portfolio and saying, oh, let me diversify kind of my portfolio of drugs and figure out which one is going to be the winner. He did that, and he turned around a company by abandoning the bad drug and finding some good ones. And everybody's trying to find good drugs. Everyone wants the next ibrutinib from Celera Genomics. It's got to be lurking out there somewhere. You just got to look. But you know, this drug has proven to not work, and I would have never advanced this drug to phase 3. Any rational pharmaceutical executive would look at the phase 2 and say, why would I do a phase 3? What am I? I'm replicating a 1.8s cog change, half a point. Why would anybody want to replicate that? And the answer is, well, they don't have any other drugs, so they have to replicate it. Like the problem with biotech is that if you have one drug in your pipeline and it fails, there's no reason for you to be employed. There's no other drugs. So you got to keep that pipeline coming. And when there's failures, you have to be disciplined and say, all right, we lost 12 million developing 𝗍𝗲𝗏. Let's not lose 120 million. And I have those kinds of conversations all the time internally. They're like, look, we can afford to lose 3 million or 5 million. We can't afford to lose 30 or 50 in the case of my company, because we have 5 or 6 bets, and losing 30 to 50 would be very painful. So they just wanted to get more, you know, salary, more bonuses. He worked at the company with his wife, which, you know, I'm sure they felt like very successful, husband and wife couple, like, you know, but they were not basing themselves in reality. They were just kind of hoping that they, you know, they would become something that they weren't. You know, they wanted to be so successful. Who doesn't want with their partner to be in charge of a company and make billions of dollars? That sounds amazing. And when the data came in that wasn't what they kind of bargained for, they changed it. And to me, that's the most criminal part of this. I feel bad a little bit for Dr. Wang, and I'm very much a softie in all this stuff. A lot of people have no heart about any of this stuff. I feel bad for Dr. Wang. He's an old Chinese guy in bad health. He cut some corners on Western blot, you know, it's being charitable. You know, he definitely defrauded a ton. But it's preclinical work. At the end of the day, I'm not advocating for this, but every scientist does it. And it's just the way of the world, for better or worse. But when you start messing with human clinical data and defrauding there and doctoring that data, that's where that's where it gets like, unacceptable to me. Like you cannot take human data and start messing with it and pretending that it's better than it actually is. You're just fooling yourself. And they of course caught them, and they had to resign from the company and settle and pay and all this stuff. And again, the explanation, according to some longs, and I'm happy we have longs, because otherwise the stock would be at $3 and there'd be no opportunity to short it. So I'm grateful. There's misunderstanding and misinterpretation. People are like, Mario, why are you try so hard to correct the record. Why would you do that when all these people are just leading themselves over a cliff? And the answer is tough. It's like, on one hand, like I kind of do feel bad. The most optimal thing for me to do would be to shut my mouth and let them ruin themselves. But I'm sure I convinced a couple people to, get out of the stock, and I'm happy about that. And, they'll save some money. And I've done this before. But the general thing is like, oh, this is all self-serving. You want us to dump the stock, so the stock goes down and you make money. And it's like, no, I'm going to make money when the results come out. I don't care what the stock does between now and then. I want to make money when the results are out. So anyway, that's the couple of interesting things here.
Run the